Good day. My name is Elvin Green, and this is my presentation for ADHD and ADD. Before I begin, I would just like to mention that in the new DSM-5, the diagnosis of ADD and ADHD is just plainly now ADHD. Um, and ADHD basically persists in the pattern of inattention or hyperactivity, impulsivity that interferes with the individual's daily life functioning. The inattention aspect of it, um, an individual has to have six or more symptoms that persist for at least 6 months, and then that 6 months has to be to a degree where it interferes with the person's daily functioning, daily life, whether as it relates to responsibilities and things of that nature. Um, a few of the symptoms. I'm gonna go over just a few in my video. Afterwards, it will present um, sort of a little bit more in depth way that the new DSM-5 has broken down uh, ADHD. But for just a few of the symptoms, you have often fails to give close attention to detail, difficulty sustaining focus on task, often does not follow through on task, or often loses things necessary for a task, often forget on daily activities as it relates to adults. It could be forget to return a phone call, paying bills, etc. Those are the things that, just to name a few, because like I stated, you have to have six or more of the following symptoms, and they have to persist for more than 6 months in order to be diagnosed with ADHD. As I move on, ADHD has been broken into sections, hyperactivity and impulsivity. The same rules apply. You have to have um, some of the symptoms. They must persist for more than 6 months, and you have to have six or more. Um, what I need to make note of right now is the fact that 17 and older, you will have to have five or more of the symptoms that persist. When we look at hyperactivity and impulsivity, some of the symptoms are often fidgety, with taps on hands or feet, often leaves seat in situations where remaining in the seat is part of the task, often runs about or climbs in situations when it could be considered inappropriate, often talks excessively, often blurts out answers prior to questions being asked, before questions being asked. And those are some of the factors. And as it relates to these two, impulsivity and hyperactivity, there are other factors that are involved. For instance, you have to have there has to be several inattentive or hyperactivity symptoms where it was prior or present to the age of 12. Symptoms are present in more than two locations. That could be home, that could be school, that could be somewhere in a market or something of that nature. And there has to be clear evidence that interferes with the individual daily functioning. So, as you can see so far, ADHD, hyperactivity, impulsivity, all falls under the main function that a person has to exhibit six or more characteristics, and it has to be present for more. Yes, it has to be present for at least 6 months. A 17-year-old has to display five or more. 17-year-old or older has to display five or more symptoms, and it has to be present for at least 6 months. Um, when we look at ADHD, it has to be specified, and it has to be specified whether it's in full or partial remission. Full, partial, or severe remission. That those are the specifications of that particular diagnosis. It's important to have that. Key notes that I would like to share when it comes to inattentiveness, it must manifest behaviorally. Inattention must manifest behaviorally in ADHD as wandering off task, having difficulty sustaining um, focus. So I remember working in a partial hospital with 3 to 13-year-olds. That was primarily the main diagnosis that was displayed in the majority of the children there. A lot were hyperactive, couldn't remain focused. Just during schoolwork, they couldn't remain in their seat. Um, Bothering other peers when the teacher was giving examples or going over classwork, um, and even having assistance when it comes to one-on-one. The one-on-one assistance is rarely um, beneficial or helpful to the situation when you have children who persistently, again, and this is the key that we need to realize is that these children that display these symptoms are it's the cause and effect method due to trauma that they experience in their lives. So if we can understand that one factor right there, that their behaviors is due to trauma that was experienced in their lives, then it would make things I would say for professionals a lot easier to work with children who are displaying hyperactivity and also impulsivity. And also you have children who are on the autism spectrum who also displays um, levels of ADHD. Although it could be, that has to be really looked at because some of the symptoms of autism could overlap with the symptoms of ADHD. So as I go on, hyperactivity, as I stated, inattention manifests behaviorally in ADHD as it relates to wandering off the task, not remaining in the seat when it is appropriate. Hyperactivity refers to an excessive motor activity. I remember working with a young man who constantly stayed in the behavioral room because in the classroom he couldn't stand his seat. He was always bothering peers, blurting out answers. And he was, I remember, if I remember correctly, he was 4 years old at the time. So he was displaying just about every um, criteria criteria that relates to ADHD. And what I remember is that they just medicated him, and the days that his parent ensured that he was medicated, he came to the program or the partial hospital program just like it was nothing. Like he was almost in a state of comatose where he hardly moved. He was moving around slow. Just that hyperactivity, and then in essence, I would say hyperactivity sometimes can be confused with just regular childhood behaviors. But then that's when you have to uh, differentiate between the time limit of it and the severity of it, and the timing of it, meaning that when those behaviors are displayed. So when we refer to impulsivity, that refers to hasty actions that occur in a moment. For instance, a child sit in a seat while he's trying to do schoolwork. The schoolwork is frustrating, and he pushes his paper and throws his pencil across the classroom. That is considered impulsivity. Just doing a behavior without the forethought or without even thinking. Um, just doing and or reacting to certain stimuli, I should say. So what we can note is that the prevalence of ADHD in a population survey uh, that was completed, it has been found that it occurs in all cultures and 5% of children and 2.5% of adults. Um, this could possibly be higher percentage as we become more aware of certain behaviors. Um, as children are in positions to be um, observed and analyzed more often, because in the end, this type of behavior does go into adulthood. So what I would like to do now is just to share my video from YouTube as it relates to ADHD and ADD. ADD, again, the diagnosis and the new DSM-5 is just ADHD. So thank you for joining me for this brief summary overall, and I hope you enjoy my video. Thank you.